Hello and welcome to the show, Good Governance Watch. My name is Blessing Iriaka and this is C-AdvocateTV. Today on this episode of our Good Governance Watch, we want to talk about something that concerns every citizen of the Federal Republic of Nigeria, and we are talking about the healthcare sector. So recently, the former presidential aspirant of the Labour Party made a comment on his social media platforms. He actually made a post based on the life experience he had while on transit with a young girl from Nigeria. And the comment he made says, a standard ambulance costs about 150 million. That is $100,000. And Nigeria spent 39 billion refurbishing the National Conference Center in Abuja and 21 billion rebuilding the vice president's residence. He went further to say, the 21 billion refurbishing and that of the the 21 billion project and the one of 39 billion totaled 60 billion. And he said these two projects alone could have provided the nation with 400 brand new ambulances, roughly 11 per state, including the FCT. And he went ahead to mention what happened to a popular figure recently in Nigeria known as Anthony Joshua. Most of us have seen what happened to Anthony Joshua and how the healthcare system came to his rescue. So today we have a healthcare expert with us who will be telling us the importance of ambulances when it comes to the healthcare sector. He has already mentioned that 400 brand new ambulances would have been bought with the money that was used for the other things in Aso. So saying that if Nigeria puts its priorities right, then we'll have to get a lot of things right in Nigeria. So the healthcare expert is going to be telling us the use or the importance of ambulance in the healthcare sector. Welcome, Mr. Stephen.
Thank you for having me, Blessing.
Thank you. So before we go ahead with what we have, just go ahead and tell us who you are, and so that our audience will know more about you.
Okay. My name is Stephen, public health practitioner and C-Health coordinator. Thank you.
Thank you so much. So moving on, we want to know, as a health practitioner, how critical are ambulance services in the healthcare sector?
Okay. Talking about ambulance in the healthcare sector. Let's look at it that ambulance is a means of transportation, taking an injured person to a hospital. Then the importance is not something that we'll overlook, because someone living in a rural area, for instance, and a pregnant woman breathing at night, if there is no emergency route to take or convey the woman to a secondary facility, that could cost the life of that woman. So ambulance is not something that we just say is a car or a moving vehicle. It's more of a mobile clinic. It's more of a mobile clinic. Thank you.
Okay, thank you so much. So moving on, we want to know what gap currently exists between the Nigerian ambulance and emergency response system in Nigeria. So can you actually say that in Nigeria we have emergency response system, ambulances are working, people are actually using the ambulance or something like that?
Okay, when you talk of the gap, it's not just having numbers of ambulances.
Okay.
It's all about the functionality. Yeah. We can have 100 ambulances in health centers across the state. How many of them are functional? And when you're talking of the gap, let's look at the roads, which is the infrastructural development. The road is nothing to write home about, because the road must be clear, smooth, and accessible for the ambulance to take the route to the hospital. Apart from the road, then do we have paramedics, like trained nurses that can be able to coordinate? So if let's take for example, a child is having seizure and you're taking the child to a hospital, then is the road accessible? Because every minute counts in life. Every minute counts. Then if you're taking that child to a hospital, from the standpoint of the incident to the secondary facility, which is the hospital, then do you have a good road? Do you have a trained personnel? that at least can be able to resuscitate the baby before they get to the hospital? And as well, do we have equipped ambulance that are ready? Because sometimes for that most of them don't have fuel, most of them are not functional.
Yeah.
So most of them, they tell you the LGA team or the OIC or the local government have not released funds to buy fuel. So they may end up using the local means of transportation, which is the motorcycle or the tricycle, which you know as keke. So the gap is something that you cannot cover in a year, but we can start from somewhere. Thank you.
Cannot cover in a year, but
Yeah,
we
you can start from somewhere.
Okay, we actually want to know how, should I say facilities like this, like the ambulance, will actually help in the healthcare sector, more especially in Nigeria. Just like P2B cited with what he said, he talked about Anthony Joshua. I don't know if you saw the video of Anthony Joshua when the accident happened. You saw there was no, should I say, ambulance or healthcare response team on site. So it was actually individuals who were trying their best to get him out of the car and everything. So based on this, if we should have enough ambulance, just like he mentioned, how do you think it will improve the healthcare sector in Nigeria?
Okay. I will respond to this particular question by citing an example.
Okay.
When you talk of health is a complete state of physical and emotional mind, right? Now, when you talk of health promotion and awareness, it's not just all about paramedics or doctors or nurses. When you talk of emergency response, I think everybody should be part of it. At least emergencies happen at home, in schools, even at workplace. So everybody should be equipped with at least the basic emergency response, like the first aid, the CPR, and all the rest of them. So if we have ambulances or ambulance in all the centers, primary health centers, hospitals, and we have trained personnel, when emergencies happen, it's very easy for them to navigate and respond timely. And as well, a well-coordinated communication, because in most cases, you find out that the ambulance may be taking someone to a hospital, but there is no communication to where they are taking the person. And sometimes when they get to the hospital, you find out that there is no available bed space for that patient or the client, or there is no doctor around that will attend to the patient or the client. So this cause a whole lot of damages in the health system. So if you have emergencies, mobile clinic, like I call the ambulance, in those health centers, is to help when there is emergency, conveying that person and also saving life, and not just numbers. Because even though we have 2 ambulances or ambulance in the health center and they are all functional, I think we'll have a better way of saving life. Because the primary goal of the whole thing is making health affordable and accessible to every members of the community. Okay, let's just come down home. We are in Imo State, so let's talk about Imo State. So when it comes to the Imo State healthcare, what do you think about emergency response? Do we have ambulances available in the system where we can, just like you mentioned, communication or the first point, can somebody have an emergency and then that, I can actually call these people to get the ambulance to convert this one from this point to that other point? Do we have things like that in Imo State? Okay, you are a citizen of Imo State, right?
Yes.
Do you have in your village? Let's start from there. Yes. So in your own community, in your own village, do we have in your village, or have you heard such?
Yeah, I actually don't reside in the village, but I think for the few times I've visited the village, I've not seen anything like that. So you being in the health sector, I feel maybe.
Okay.
Yeah.
We have a transport system in Imo State, though is bus.
Okay.
Then that we use in the place of ambulance. But remember that a good ambulance should have some basic equipment. It should have defibrillator. It should have emergency kits whereby you can be able to give support to the victim before the secondary help will arrive. So, but we have buses that we can use to convey these people. Though most of these buses, most of them have spoiled, most of them are outdated, most of them are not functional, and the local government are not doing better when it comes to fixing this transport system. And most of the OICs, which is officer in charge of some facilities, they even convey or use these vehicles for their personal use. Yes. Some of them use it to carry vaccines from the cold store.
Yeah.
Yes, they used to carry vaccine because that's the only way they can get vaccine and also save costs. So some other facilities or health centers, they use it to carry their personal goods.
Wow.
And also for their personal use. So if we have a working ambulance in Imo State, definitely, and will intensify the effort for emergency health and emergency training or first responder training, just like we are doing, then it will go a long way to save life, and as well, it will go a long way to protect some traumas that can be easily reversible without causing permanent damage. Thank you.
Thank you so much. Okay, thank you so much for that clarification. And I just wanted to mention something. I think you already mentioned that you talked about transportation and then talking about the ambulance in Imo State. You are using the bus and the rest of them. So I wanted to ask, but you've already mentioned, but I think you can go in depth. What are some of those things that we see in, should I say, a good or quality ambulance? So, we're talking about ambulance, and Nigerian government might tomorrow decide to, okay, these people are talking about ambulance, let's just give them, 400 ambulance, 11 for each state. And then when they give it, we'll now have another problem of the ambulance not being, of standard. So what are some of those things as a health practitioner that must be in an ambulance?
Okay, at least a good ambulance should have a defibrillator to resuscitate a victim. Okay. A good ambulance should have some minor drugs, aspirin, pain relief. It will as well have a way or CPR where you can give the at least valve max or ambu valve that you can use to resuscitate the person. Remember, like if you bring the idea that say that ambulance are mobile clinic or moving clinic, that means you can give a minor life support to the patient or to the victim before the secondary help arrive. So when you have these things, at least defibrillator to give shock to the heart for someone that is having a heart attack, then aspirin for someone that's having heart attack as well, at least to give at least inhalers to give this life support before the secondary help. Definitely, you can have a good ambulance. Not just having chairs and stretchers.
Yeah,
no,
chairs and stretchers, exactly.
It's same thing as having normal bus or normal tricycle. Yeah.
Okay. So thank you so much for that. But before we let you go, we want you to, what do you think about Peter Obi's opinion on the government? I know you're not a politician, but I just want to get you involved. So what do you have to say? Because you're a citizen of the Federal Republic of Nigeria, and good governance, when we talk about good governance, it involves everyone. So do you think what Peter Obi is saying is making sense? What do you think about the Nigerian government and their expenditure? Peter Obi is saying the money you use to go and do the conference center, the money you use to go and do the vice president's residency, if you had channeled it in the healthcare sector, you would have gotten us about 400 ambulance. Do you think that actually makes sense?
Yes, I think because citing from what Peter Obi said, definitely I agree with him because one, let's use SDD as an example for cold chain officers, where you get the vaccine safe, you maintain the potency of the vaccine. Then those SDD, they are provided in facilities and they are using solars as well to maintain the potency of the vaccine. From that point, from the cold chain in the state down to the local government and maintaining that cold chain, you understand? So it's also an emergency response system to vaccines. Then now, if Nigeria are spending millions and billions in renovation and every other activity, then as well we can spend more in the health system because health is wealth. And it's only a healthy person can be able to stand and say what will happen tomorrow. You understand? When you spend more, at least I even have to use this opportunity to say a very big thank you to the National Primary Healthcare and the State Primary Healthcare because they are doing a lot. And perhaps most facilities, most LGAs are having new structures. But while these structures are coming up, let's not forget that we should equip these facilities with basic life support. We should have our staff trained, that is routine training on basic life support, first aid and emergency response. And as well, whether that someone living in underserved community can be able to access healthcare, can be able to access an affordable healthcare. You don't need to travel miles. before you can have a health coverage. So I agree with P2B because health is wealth.
Wow, thank you so much for that. This is me appreciating you for being on the show. And this is where we're going to call it a wrap on today's episode of the show. If you actually have any comments based on this particular topic we discussed today, do you agree with P2B? Do you agree with Steven? Then put a comment in the comment section. My name is still Blessing Ireka, and this is C-AdvocateTV.